If you looked down at your toilet this morning and saw foam or bubbles that didn't go away in a few seconds, stop what you're doing. Because what I'm about to share with you in the next few minutes could literally save your kidneys. And nobody, and I mean nobody, is talking about this the way they should be. Most people think foamy urine is just from going too fast or not drinking enough water. But here's the truth that your doctor might not have time to explain. Persistent foam in your urine is one of the earliest warning signs that your kidney filters are leaking protein. And once protein starts leaking, the clock starts ticking. Stay with me because drink number 1 on this list costs just 12 cents to make every morning, and research suggests it attacks all 3 root causes of kidney damage at the same time. You are not going to want to miss that. If you're new here, welcome to this channel, and please hit that subscribe button right now. Now, let's talk about what's actually happening inside your kidneys. Your kidneys contain tiny filtering units called glomeruli, about 1 million of them in each kidney. Think of them like a fine mesh screen. Their job is to filter your blood, keep the good stuff like protein inside your body, and push the waste out through urine. When those filters are healthy, your urine comes out clear and quiet. But when inflammation starts attacking those delicate filters, and this happens silently with almost no pain, the mesh develops tiny holes. Protein that should stay in your blood starts slipping through. And what does protein in your toilet look like? Foam, persistent, stubborn foam that stays for more than a minute. Here's the part that should really get your attention. A landmark study published in the American Journal of Kidney Diseases found that even mildly elevated protein in urine, called proteinuria, is linked to a significantly higher risk of kidney failure and cardiovascular disease in older adults. And the most dangerous part? It can go on for months, even years, with no symptoms other than that foam you keep seeing and ignoring. Let's start at the bottom of the list and work our way up, because this is where it gets fascinating. Coming in at number 8 is cucumber, mint, and lemon water. Now, I want to be honest with you. This is the trendy infused water you've probably seen all over social media. Does it help? Mildly, yes. Cucumber has small amounts of silica and antioxidants, lemon provides vitamin C, and mint is soothing to digestion. But here's the truth. This combination barely moves the needle when it comes to actual kidney filtration repair. It's pleasant, it encourages hydration, and hydration always helps your kidneys. But don't rely on this one alone. Think of it as a nice bonus, not a solution. Number 7 is dandelion root and honey tea, and this one is dramatically more powerful, but most people brew it completely wrong. They use dandelion leaf, not the root, and they steep it for only 2 minutes. You need to use the dried root, and you need to simmer it for a full 15 minutes to extract the active compounds, especially taraxacin and inulin. Research from the Journal of Alternative and Complementary Medicine found dandelion root acts as a natural diuretic while actually protecting kidney tissue rather than stressing it, which is the opposite of what most pharmaceutical diuretics do. Add raw honey after cooling slightly, not while boiling, to preserve its anti-inflammatory enzymes. Number 6 is something you have almost certainly thrown in the garbage: corn silk tea. Those pale, stringy threads you peel off your corn, do not throw them away again. Corn silk contains masin and other flavonoids that research has shown reduce inflammation in the urinary tract and help decrease protein excretion in the urine. A study published in Evidence-Based Complementary and Alternative Medicine found it demonstrably reduced proteinuria in animal models with kidney disease. Steep a small handful of dried corn silk in hot water for 10 minutes, strain it, and drink 1 cup daily. It has a mild, slightly sweet taste. This is one of the most underrated kidney drinks in existence. Number 5 is barley water with lemon, an old-fashioned remedy that's nearly disappeared from modern conversation, and that's a genuine loss. Barley is rich in beta-glucan, a soluble fiber that research shows reduces inflammation and helps manage blood sugar fluctuations, which are a leading cause of kidney filter damage in older adults. Simmer whole pearl barley in water for 30 minutes, strain the liquid, cool it, and add fresh lemon juice. Drink 1 to 2 glasses per day. This isn't glamorous, but it works, and it works consistently. Number 4 is stinging nettle and lemon infusion. And here's the number that stopped me when I first read it. A clinical study found stinging nettle extract reduced urinary protein excretion by up to 34% in patients with early kidney disease. 34%! That is not a small effect. Nettle is packed with lectins, polysaccharides, and quercetin, compounds that actively work to reduce the inflammatory damage happening to your glomeruli. Steep dried nettle leaf, not fresh, which can irritate, in hot water for 10 minutes. Add lemon and drink once daily. This is one of the most underrated kidney drinks. Number 3 is Punarnava tea, and I want to spend a moment here because this ancient Ayurvedic herb is largely unknown in Western wellness circles, and it absolutely should not be. The name Punarnava actually means one that renews the body in Sanskrit. Its active compound punarnavine has been studied for its ability to protect and regenerate damaged kidney cells, reduce edema caused by poor kidney function, and lower creatinine levels, which is a direct measure of how hard your kidneys are working. Multiple studies in Journal of Ethnopharmacology support its effectiveness. Look for dried punarnava root at Indian grocery stores or online. Steep it for 12 minutes. This is one of the most powerful kidney-specific herbs on the planet. Number 2 is fresh parsley, celery, and lemon juice, a raw green juice that delivers a concentrated anti-inflammatory punch. Parsley contains apigenin and luteolin, two flavonoids shown in research to reduce kidney inflammation and inhibit the enzymes that damage filtration tissue. Celery adds natural sodium-free electrolytes and phthalates that help relax the blood vessels feeding your kidneys, improving filtration pressure. Together with lemon's citric acid, which helps prevent kidney stone formation, this is a serious therapeutic combination. Juice half a bunch of parsley, 3 celery stalks, and 1 full lemon. Drink it fresh 4 to 5 times per week. And number 1, the 12-cent morning drink that targets all 3 root causes simultaneously is coriander seed, cinnamon, and lemon water. Here's why this combination is extraordinary. Coriander seeds contain linalool and geranyl acetate, which studies show reduce oxidative stress in kidney tissue directly. Cinnamon, specifically Ceylon cinnamon, not cassia, improves insulin sensitivity, which directly reduces blood sugar damage that destroys kidney filters over time. And lemon provides citrate that flushes crystalline deposits from your filtering units. Boil 1 teaspoon of crushed coriander seeds with half a teaspoon of Ceylon cinnamon in 2 cups of water for 8 minutes. Strain, cool slightly, and add fresh lemon juice. Drink it every morning on an empty stomach. Simple, inexpensive, and genuinely powerful. Now, here is your 30-day plan. Weeks 1 and 2, start with coriander cinnamon lemon water every morning, but add barley water or corn silk tea in the afternoon. Weeks 3 and 4, introduce nettle infusion or punarnava tea in the evening and add the parsley, celery, and lemon juice 3 times per week. Rotate through the other drinks as you enjoy them. But before you go, 5 mistakes that will completely sabotage all of this progress. Number 1, continuing to eat high-sodium processed foods while drinking these teas. Salt forces your kidneys to work harder and undoes everything. Number 2, skipping plain water. These drinks support your kidneys. They do not replace water. Aim for 6 to 8 glasses daily. Number 3, drinking alcohol regularly. Even moderate alcohol raises creatinine levels and increases filtration stress. Number 4, taking these drinks alongside blood thinners or diuretic medications without consulting your doctor first, especially nettle and dandelion, which have real pharmacological activity. Number 5, expecting overnight results. Kidney tissue heals slowly. Give this a full 30 days before you judge. Your kidneys have been quietly working for you every single day of your life. Give them back some of what they need, and that foam in your toilet, it may just disappear. If this video helped you, please share it with someone you care about. Leave a comment below telling me which drink you're going to start with. I read every single one. And if you haven't subscribed yet, do it now. Your kidneys will thank you. I'll see you in the next one.